Spillover, surveillance, and saving lives. The threats posed by emerging infectious diseases continue to grow. And while it can be easy to focus on the latest headlines, a step back reveals a bigger picture. The wildlife trade and bushmeat supply chains are prime drivers of spillover. But growing evidence suggests that these activities have been declining in recent years, especially in the face of intensified surveillance, legal action, and public awareness campaigns. So today, we're going to dig into One Health initiatives aimed at integrating surveillance across animal, human, and environmental health sectors. We'll look at how programs like Stop Spillover are developing GIS-based hotspot mapping to pinpoint where zoonotic pathogens are most likely to jump to humans, and what we might learn from their unique approaches. To start, let's talk about spillover because this is such a key concept in understanding how pandemics begin. Zoonotic spillover refers to the process by which an infection that has been maintained in an animal population jumps to humans. While there are many ways that this can happen, the exact moment when this transition occurs is often difficult to identify and pinpoint. It's typically not a sudden event, but rather the culmination of many smaller changes, including how people interact with animals and the environment, as well as the animal's behavior and ecology. When we hear about spillover events, we often think about where the first cases of infection occurred. For example, the 2003 SARS outbreak is believed to have originated from a single seller of civet cats in southern China, whereas the 2014 Ebola epidemic in West Africa is thought to have started with a 2-year-old boy who was infected by a fruit bat. But while pinpointing the exact source of an outbreak is important for rapid response efforts, it also risks overlooking the underlying factors that allowed the pathogen to jump species in the first place. Understanding the conditions that allow pathogens to spill over from animals to humans is therefore crucial for preventing future outbreaks. And here it helps to take a step back and look at the bigger picture. For instance, both civet cat sellers and bushmeat hunters may play important roles in their local economies, cultures, and food systems. So simply shutting down these activities is neither feasible nor equitable. Rather than focusing on individuals or particular locations, then what we really need is a deeper understanding of the systems that drive spillover events. It's a complex web of ecological, economic, social, and political factors. But according to a paper published in 2023 in the journal Nature, the wildlife trade and bushmeat supply chains are among the most significant drivers of spillover risk. These activities bring people and animals into close contact and create conditions ripe for pathogens to jump species. This risk extends beyond the immediate buyers and sellers too, and can impact anyone who lives or works within the supply chain. That includes farmers, traders, transport workers, market vendors, and more. Unfortunately, the consequences of spillover can be devastating. For humans, infections can range from mild to severe, and some viruses like Ebola, Marburg, and Lassa can be deadly. For wildlife, the story is much the same. A disease that starts off affecting just a few individuals can quickly decimate entire populations. Take, for example, the 2018 to 2020 Ebola outbreak in the Democratic Republic of the Congo, which saw 2,280 people infected and over 1,500 die. The outbreak affected 9 provinces and killed more than half of the affected population of bonobos in one region. As we know all too well from recent experience, infectious diseases can spread rapidly and pose a serious threat to both human and animal health. In fact, 75% of emerging infectious diseases in humans come from animals. With spillover events becoming more frequent, the stakes have never been higher. The impacts of COVID-19, for example, have been felt around the world with over 7 million deaths and major disruptions to education, economies, healthcare systems, and more. Given the far-reaching impacts of infectious diseases, One Health initiatives have emerged to address spillover at the human-animal environment interface. One Health is an approach that recognizes the interconnectedness of human, animal, and environmental health, and emphasizes the need for collaboration across sectors to address shared challenges. Launched in 2004, the initiative has grown significantly and now has over 60,000 members from 190 countries. But while One Health provides a guiding framework, actually implementing its principles in practice requires careful planning and execution. In particular, effective surveillance is key to monitoring disease emergence and detecting potential outbreaks early. The problem is that surveillance activities are typically siloed within sectors. Human, animal, and environmental health data are often collected, managed, and analyzed separately, which can make it difficult to identify patterns and connections across species and ecosystems. To address this gap, there have been growing calls for integrated surveillance systems that bring together data from multiple sources to provide a more comprehensive understanding of disease dynamics. Integrated surveillance can help identify potential outbreaks earlier and inform targeted interventions before a disease becomes widespread. It can also help us better understand the drivers of spillover and develop more effective strategies to prevent future outbreaks. For example, by combining data on wildlife trade, bushmeat consumption, human demographics, and disease prevalence, researchers can identify areas where the risk of spillover is high and develop targeted interventions to reduce that risk. One organization at the forefront of this work is the Society for the Prevention of Animal Cruelty to Humans and the Environment, known as SPA-CHE, founded in 1999 and based in Marseille, France. The SPA-CHE is a nonprofit organization dedicated to protecting both animal and human health through research and field projects focused on preventing the emergence of infectious diseases. One of the organization's most notable contributions is the development of a geospatial platform called Stop Spillover. STOP Spillover stands for Surveillance to Track and Observe Pathogen Spillover Events. As the name suggests, the platform uses Geographic Information Systems, or GIS, to map and analyze data related to spillover events. The platform's primary objective is to identify hotspots where the risk of spillover is highest. By analyzing a variety of data sets, such as wildlife trade routes, bushmeat markets, and species distribution, the platform can pinpoint areas where humans are most likely to come into contact with zoonotic pathogens. These hotspots can then be prioritized for surveillance and intervention efforts, allowing public health officials to allocate resources where they are most needed. In addition to identifying hotspots, the Stop Spillover platform also allows users to track the spread of diseases over time. This function is made possible by integrating real-time data on disease outbreaks and environmental conditions. By monitoring disease trends, public health officials can identify emerging threats and respond quickly to contain outbreaks before they become widespread. To achieve these goals, Stop Spillover integrates data from a wide range of sources. Wildlife trade data, for example, can come from government agencies responsible for regulating the wildlife trade, such as the Convention on International Trade in Endangered Species of Wild Fauna and Flora. Bushmeat market data can be gathered through surveys and interviews with hunters and traders. And species distribution data can come from a variety of sources, including academic research and online databases. Once the data is collected, it is integrated into the Stop Spillover platform, which uses GIS to analyze and visualize the data in a user-friendly way. The platform's interface allows users to zoom in and out of different areas and view data on a range of topics, including wildlife trade routes, bushmeat markets, and disease hotspots. To date, the platform has been used in a number of countries to identify areas where the risk of spillover is highest. For example, in the Democratic Republic of the Congo, Stop spillover has helped identify areas with high levels of bushmeat consumption and wildlife trade, which are prioritized for surveillance and intervention efforts. Similarly, in Indonesia, the platform has been used to identify areas where deforestation and agricultural expansion are bringing humans into closer contact with wildlife, increasing the risk of spillover. In these and other contexts, the Stop Spillover platform has been an invaluable tool for public health officials working to prevent the emergence of infectious diseases. By providing a clear picture of the factors driving spillover, the platform allows decision makers to allocate resources effectively and develop targeted interventions. Ultimately, the goal of the Stop Spillover platform and other similar initiatives is to create a world where humans and animals can coexist peacefully without the threat of infectious diseases. It is a lofty goal, but one that is essential to the health and well-being of our planet. Thank you for watching this episode of Nature's Cat Videos. If you enjoyed the topic, please consider making a donation to the Wildlife Conservation Society by clicking the link in the description below. Their mission is to conserve wildlife and wild places worldwide. They have helped protect over 600 species and saved countless lives.